I don't think you go to school to be a therapist. I think you're born as one.
Behind the scenes, what are we as therapists talking about?
The idea isn't what you do, but why do you do it?
The why is almost always more interesting than the what.
That's the unsaid thing.
Oh, I'm saying it. I'm going there.
Insights and Actions is for educational and entertainment purposes and is not a substitute for working directly with a mental health or medical professional. With that said, here we go. So here we are, Insights and Actions podcast. To my right, y'all know him, y'all love him, the legendary Craig James.
Oh, wow. The legendary. Well, to my right, Dr. Johnny Pierce. Don't call him doctor.
Don't call him doctor. And to my far right, or my left, because I'm right in the middle. I like to play the game that way. Got Matt, don't call it Matt Check Christian. The man, the myth, the legend.
Now, in contrast to Johnny, I'm not a doctor, but I insist you call me doctor. Yeah, the people in my personal life. No eye contact and doctor. So in terms of what we wanted to get into today, I mean, I think this is at the heart of everything. I think this is one of the most, especially with something like therapy, this is kind of the most important question of how does change actually happen? And what do we see that works or not? Yeah.
Does therapy work or not?
Does therapy work or not? I think that's the starting point.
Well, let me add to it. There's a type of therapy.
Mm-hmm.
Is it CBT, DBT,
Mm-hmm.
A, B, C, D, E, F, G.
right?
EMDR, and there's ACT. There's so many different kinds of
Yeah.
Well, I mean, I think one thing that's clear in the research is that therapy work. It does help.
Oh, yeah.
It does work.
Better than placebo.
Better than placebo, and it can have long-lasting effects. But getting at why does it work? How does it work? And do all of these letters, all of these different approaches matter? What's y'all's take on, one, tell me if you disagree with what I was just saying there, and also with the different types of therapy that get thrown around. How much do you think that matters?
I do. I believe it works. If I didn't, I don't think any of us would be doing it.
Yeah.
My take is I don't believe in modality therapy. And that's what we've heard for years. We'll get calls and
Can you just interrupt? Can you explain what modality means for people who are
so modality
in the field or
I want CBT, I want
Right,
DBT, I want
Right.
EFT. And so I think they're therapeutic techniques.
Right. Yeah.
And they do have value.
Mm-hmm.
I have found that if you sit in one modality too long,
Mm-hmm.
you're gonna miss something.
Always.
Like CBT, cognitive behavior therapy, tons of value,
Well studied and researched.
well studied,
Mm-hmm.
but doesn't take into account the emotions that drive behavior.
Not even a little bit.
So if I just look at the behavior and I'm ignoring the emotion, so I think my take is I like to say I'm eclectic.
Mm-hmm.
I'm going to utilize what I believe is most important for the client in the session.
Yeah.
Today, it might change the next session, but I need to be able to pull from multiple pieces. And I don't think that happens overnight. I think it takes some time to understand the modalities, research them, practice them, get trainings, this, that, and the third. So my answer, it works. I subscribe to clinical techniques, but I don't do modality therapy.
I'm about the end game. So when we say does therapy work, I have to ask, what does that mean? What are we qualifying as working? Does it work if you're happy? Because if that's the only way that you qualify therapy as working, then guess what? It doesn't work because therapy is not going to make you happy. You're not going to be in this constant state of bliss where nothing can ruffle your feathers and things of that nature. So if that's what you're looking for when you come into my office, and I'm talking about mine in particular, it's right down the hall, you're not going to get that. And since you're not going to get that, that might keep you away. But if you see therapy working, meaning something to the effect of you can be in different situations and manage your emotions throughout that process, you can make goals and make decisions that build up towards getting that goal accomplished. If you see therapy working through that lens, then, hey, look me up. I'm here for you because I can help you with that. And you can have success that way. The working or not working seems to me about a measure of success. As far as modalities and what makes therapy work? Do the types of therapies matter? I think CBT has been well studied and documented, and I think people really like the idea that they can actually like map out how it's gonna go. So I'm gonna talk to you about how you're thinking about things, and I'm gonna give you this nice sheet of paper, and we can write down your thoughts, and we can challenge those thoughts. And then when the moment comes, you're gonna make the right decision. That can work with some clients. I've seen it be very successful with some clients. But as Craig, you mentioned, it's cutting out a big piece of the puzzle, which is feelings. Feelings and thoughts occupy the same space, but they got very different jobs. And more times than not, people are making decisions based on how they feel. So if I'm taking the approach that your thoughts are going to be the key, but I never spend any time dealing with, addressing, understanding, unpacking your feelings, you're going to find that therapy may not work for you because I still have this stuff come up.
Yeah.
And one thing that's, I'm sure people that aren't in the field or some people that are in the field aren't super aware of is that when looking at the research, the outcome research is of all like the main therapies that people do, there's really not much at all difference in terms of how effective these therapies are.
Common factors.
And then so it's like, well, now I also want to say it's not like anything people would do in a room would be helpful. I mean, there's all kinds of like nonsense.
Spaghetti therapy is not going to help you.
Yeah. And there's certain things that are, so there's certain caveats to it. But like, if that's not it, what are the factors that are helping people in therapy?
Well, before we get to that, I just want to throw this out there as far as those orientations, modalities. I think they offer a lens. And I think that if you are going to work with people from diverse backgrounds, with diverse histories and so on, you can't have a single lens that you look at all people through. You just can't do that. You can know CBT like the back of your hand. You can know DBT. You can know, you can go old school. You can be analytic. You can do all those different things. But if you can only see people through that singular lens, there's going to be so many people who fall outside of your scope. It's going to limit it's going to limit who you can actually help. So you got to have that piece of it. And as a result, becoming more interested in what's out there, what's going on, what are the studies saying? Because the common factors that you touched on, one of the first and most important ones is relationship. Regardless of the modality, regardless of the letters you use, if you cannot form an adequate bond with a client, all of your skills are going to waste.
Well, which is your question. What is it? If the modalities are important but not intrinsically the foundation, how do we get people better?
Well, there's my experience working with people. I mean, and then I think a lot of it is the relational stuff, and even going back to the research. I think one thing is that it's not well understood in terms of like from a research perspective.
Not formality.
Like how is it that therapy exactly helps? What exactly are the factors? I mean, there's some things known about it, but again, this is going to like the things that in the intro you're saying, the unsaid thing of how much. So I'm gonna go on a little tangent real quick.
Go for it.
Let me hear. One thing that annoys me at times with kind of talking with therapists or hearing how people explain things is I think they're way too overconfident with what they, me, myself, us, as therapists actually understand, like how deep these explanations are and how much of it is just we're telling this certain. We can come up with really great sounding stories about things that sound like we're getting at some deep, objective truth.
Oh yeah.
But I'm super skeptical of how
confident we are.
How confident of these things, and maybe the stories that we get around it, or that we help people create around it, are helpful, maybe in some way. But what was your original question again?
You answered it. That was it. It really, a lot of how do we get people better? What is it?
What do you think? What do you think gets people better that we do in therapy?
It's kind of tag team in both your point of view. I think the ability to connect with a person, right? That first phone call, that first session, or the second, whatever. I think our ability to listen to a person's experience, and not throw it into a diagnosis right away, but just to listen to what they have to say, reflective questions, clarification, allows a person to be heard. We don't judge them. So it's your experience. So I forgot who said it. Some individual said something. Some of us endure more than most. So our ability to listen to the experience and just to make sense of it. I think the other part though is, and I've went to a training a couple of years ago, and the therapist made the comment, came into therapy to help people. They said, but I realized that very early on, most folks that come and see me have the answer to the questions.
Yep.
So our ability to put it right back on them and say, okay, what are your options? What's your experience told you? What do you want to do? And then go practice it and come back and let's talk about it. So I think it's the ability to give a perspective, to listen what they have to say, let them talk about what they think the options or the insights are. Most folks have it. And then it's okay
Why
to
do you
have
think
it.
that if they have, and I agree with what you're saying for for most people, they have the insight on some level, they kind of know what they need to do or some of what's going on for them. Why do you think prior to coming in, they can't put
Why
that
doesn't
in
it
action?
materialize?
Yeah. Or the change isn't happening.
That's deeper.
Let's do it. Get deeper.
Because I think it could be I have it. Is the environment I'm in allowing me to explore that and let that be the discussion? If I bring it up, so will the environment allow for it when the environment engage in discussion further? I think that's part of it. Will my environment ostracize me if I actually have a different point of view about things?
I think something that we offer that sometimes we're really good about saying, yeah, this is what therapy's for. This is what we do. We take people out of their world for 50 minutes to an hour, depending on how long your sessions are. And we put them in a space where it's okay. Whatever it is, it's okay. If they're angry, it's okay. If they're upset, it's okay. If they're confused, it's okay. It doesn't matter per se how they feel, that it's okay to feel however they feel. That's not something that most people are getting in their day-to-day lives. There are expectations at home. There are expectations at work. There are expectations with your kids, with your friends. People have beliefs about how you are supposed to be, and you feel those. You sense those, and you attempt to, on some level, live up to them. You don't have to do that in therapy. And when therapy's going well, a person kind of puts you to the side too. You, the therapist, sitting in the chair, sitting in the seat, whatever it might be, it becomes their space. And in their space, they can unpack these ideas they may have around the solutions to whatever they might be dealing with. And they can explore them. They can play them out. And you end up being an audience. Some are hands-on, but you get to be the audience.
Well, I think it's the exploration, and if it's safe,
Right.
right? If it's safe to explore in these four walls, and I can explore it and decide I don't want to do anything with it, it's okay.
Right.
I can explore and say, "Hey, Matt, I really want to go out and try this, and I'll be back next session. We'll talk more about it. Go for it." So I think we create a safety net at times.
Yeah. And it goes back, I think there's a piece of it too that's in what you all are saying and I think like your critique of CBT. Now I think I have a more positive view of CBT than you two do probably, to be honest.
Funny enough,
like I
like
work
CBT.
a lot out of CBT, but is the piece where the emotion isn't taken into account as much. Because often we can cognitively, intellectually know something.
Yeah.
This is what I have to do. But that part of it isn't what's driving it in the first place. It's kind of the last stage on the chain of what's happening, where even the ways of thinking about it and the behaviors coming from this deeper emotional place, often really conditioned by fear and that type of stuff. And I think that's with therapy, it's like, okay, we can talk to someone about it and then kind of understand, and that's kind of helpful. But a lot of it is like, this goes to the connection piece. What kind of experience can I have with that person?
Right.
So we can talk about their fear of feeling certain emotions, but when it comes out in a session and like we're really there with them and like we're not turning away from it, and I almost like feel this with you in the session, that can be the jumping off point of like, how do I embody that in other areas of my life where it's not just this like thinking kind of thing?
Yeah. And funny enough, I like CBT. It's a part of, I went to a school called Adler. Adler is not as well known as our good friend Freud. He's also doesn't have as many kind of side stories as Freud. I could go on about Freud, but
He has less weird views about her mother.
not so much cocaine, not so much sleeping with the clients, just a little different.
I think he didn't use enough cocaine, to be honest.
Yeah, maybe not enough. Maybe not
Controversial
enough.
take, but
Maybe not enough. But yeah, Adler really was big on the idea that we have this idea about how we are supposed to succeed. And if you look at his theory and you look at his practice, it had elements of CBT because there was this concept that if I can think about things differently, I will likely behave differently. But my goal will stay the same. Family systems was a big part of his theory. And then there was some pieces of it that were psychoanalytic. So that's, in my mind, a great example of how this one person didn't use one lens to look at and interact with his clients. And it encourages and promotes the idea that you need to have multiple lenses through which that you see a person so that you can better understand them in their context. Because we're not just working with clients as this person on a canvas. They come from an environment. They don't exist in a vacuum. CBT. I love third wave CBT. I love the fact that mindfulness got brought into it, where it's still kind of cognitive, but is now getting into a place where we encourage people to sit with emotions, get grounded, things of that nature. So it's not exclusively heady because we can't do it all just in our head. And I think therapy as a space provides a space to get it out of your head, put it out there, see what happens, play around with it, move away from labels. We were talking about that earlier and how that's become its own way of identifying the self.
how about for you all personally? Like in your own life, at times you've needed to change or made shifts in your life. What led to it for you all? If you'd be up for talking about it.
You should answer your own question.
I'll answer that question. I mean,
because I want to hear this.
Oh, I want to hear this too.
yeah.
Oh, he set up.
Oh yeah, he set up and he folded his arms.
It's because in my mind I'm trying to calibrate like how much do I want to disclose now? But well, you know, a lot of my life, my earlier life, teens, particularly like late teens, early 20s, like things weren't going well for me. You know, I had a lot of stuff, you know, into all the things, a lot of you know, depression, some substance stuff, you know, kinds of things. And you know, I'm kind of hard-headed. So for me, what the turning point was after a certain point is like I couldn't do the suffering anymore. It was leading to too much suffering, and it was like I couldn't do it anymore. Mm-hmm. So then I started making big changes, and I think this is kind of at the heart of it. Is that I started making changes or doing things that weren't congruent with my identity of myself. The things that were giving my self-identity, even in like, it was hurting me, but in a positive way with my friends, with other people. So I was like willing to do things where I was kind of almost had to throw a lot of that out. And the terror or something that goes with that of like, you know, so it's like the suffering allowed me to, or pushed me to where like I had to do the different thing.
You know, that's a big part of the theory around why people change and how people change, that it becomes too uncomfortable to stay the same. Mm-hmm. So I must change. Mm-hmm. And while that's a very popular theory, and I think it does apply to some, and it sounds like maybe you could relate to it, I've had a different change process. Mm-hmm. I didn't have that progressive struggle to a point of saying, okay, I can't go any further. I got to do something different. Mm-hmm. For me, it was very much looking ahead to this time in the future when I had more control over my life, more ability to kind of make things the way I wanted them to be. Because for me, my childhood was so out of my control because naturally I was a kid, but also, I think I mentioned in a previous podcast, dad wasn't around, mom was the primary parent, had a whole, you know, I had a village around me trying to raise me up, but most of them were women. And therefore, they could only give me so much guidance. So I kind of had to find things out on my own and figure things out. And fortunately, I wanted to. Mm-hmm. I had a confidence. I had a belief that I probably knew what was best for me as a person because I could dig into me. I could see what was going on in there. And I was curious about what was going on in there. I've always been curious about other people, but that curiosity also, thankfully, I had some for myself. And because I was curious about myself and what I could be, that was where change came from for me. It was, what could I be? How could I do this? Can I achieve this thing? Can I make this kind of life for myself? I didn't have any examples around me that gave me the impression that I could be like such and such. It was, I'm going to have to build this thing up from the ground, and I'm going to have some ideas about where I want this to go. And it was great that I had the resources in terms of people who were supportive. So even though they couldn't really put any bricks down for me, they couldn't really slap up any, drywall or anything like that. They couldn't put the windows in. They were there all along saying, you can do it. So on the off chance that I came across somebody who thought that I couldn't do it, they seemed odd to me. So for me, it didn't come from a place of just suffering where I got to a place and I had to turn around. It was more of a, I don't want to stay here because I believe there's something better for me. And as a result, I'm going to go out on the journey to find that better.
I'm glad I didn't have to go first because I'm sitting here still trying to figure out change. I think mine probably started a couple of years ago, to be honest with you, which was learning to let go.
Yeah.
I raised by my parents. And so for me, it was always the idea of, I really didn't have any struggles growing up. I'm firstborn. So all the things that go with being firstborn, that was me, right? I think my probably change was, I was a very compliant kid. Mom and or dad say do it, I went and did it. There was no questioning. So I was an outlier in terms of being a teenager. I laughed that I missed 2 days of school growing up from kindergarten to I graduated high school. One of those days was punishment. So it was my sophomore year of high school, November 1st. My mom had turned out the lights, don't give out any more candy. I gave out more candy. My punishment the next day was I couldn't go to school. So I've had 2 days I missed out of school.
That's like a reward for a lot of kids.
Yeah, right. So I'm outlier. So for me, it was always, if you saw it, you could accomplish it, go do it. Learning to just let things play out and not being involved and stuff. That was my change process. Hardest thing in the world to do because I've always had to have my hand in a lot of things. Not out of control issue. No, I enjoy being involved in a lot of different things. It keeps me attentive. But my change was learning to let things go. And I think mine came about through, wasn't marriage. It's my son. A kid, he is me. And so I had to let him do it his way, knowing what was going to be wrong and it wasn't going to work out. But then it was resilience. Like as a parent, I'm not trying to do everything right. I'm not even trying to make my kid happy, right? Because I think, I want my kid to be happy. No, I want my kid to be resilient, right? Because everything isn't going to go well.
No.
So my son is set up. He has his level of resilience is really, really high.
Yeah.
And I think that's because in our household, we required that. Not intentionally every time, but it just happened. So my change, probably letting things go, the opposite.
Yeah. I think the thing that at the heart of, in my view, like what leads to change is having new experiences.
Yes.
And going forward from that period I was talking about, of like starting to have my context change in my life, and I started to have new experiences. And having new experiences in a certain kind of way, I think, and particularly in the way where the new experiences challenge the identity, the previous identity, and these core beliefs we have. We're not good enough, et cetera, et cetera, et cetera.
Which actually goes to a conversation we were talking about before we hopped online. Those new experiences change the diagnosis, right? Because how often do we talk about clinically, well, such and such has ADHD, or they have this, or they have that. I'm like, okay, what does that mean? Right? It's a moment in time. It does make sense. But when you have those experiences, diagnostically, clinically, We hear what you say. We hear what somebody else told us about your diagnosis. But now with a different experience, does the diagnosis still fit? So I just throw that out there to add to it.
Yeah. Instead of using our critical mind for the purpose of judgment, I think we can use our critical mind for the sake of curiosity. That I am witnessing something, I'm experiencing something, I'm sitting with this human being. They are having these experiences that has some kind of context that I'm going to have to learn over time. What if what I think is anxiety is actually their attempt to assert themselves? And since they've never done it before, there's not as much confidence in it. So it seems shaky. That's where I'm getting the, okay, this seems like anxiety. But in actuality, this is the first stages of confidence. And because of the way I'm looking at it, I'm going to label it anxiety and treat it like anxiety. And I might miss this person completely because this person is overcoming anxiety by taking these steps. And because I had that one lens and I was working from there, I've missed that. So being patient with a process, being curious about a process, I think if we can bring that more into it, one, that's going to lead to more change because I'm not going to have defined it for you that you are anxious or you are this. You won't have some banner over your head waving what you are. Instead, it will be this challenge that's out in front of you. And we got to figure out if it's even a challenge.
What's your view, Craig, on diagnoses and mental health, how much it's emphasized or not, what they mean?
There's benefit. So client shows up. Two scenarios really that always come to mind. Hey, I'm dealing with this. I don't care what it is. I want help. That's person one. Second person is, hey, I'm dealing with this. What is it? Right? And so for me, the diagnosis is it's relevant to how the client wants it to be relevant. Does it formulate how I engage with the client? It can. But I want to understand better, right? So back to the original question, how does therapy work? How do we help people? How do we help people? Help me understand what's going on. The diagnosis matters. And it matters a lot for the insurance company for reimbursement.
That's a big piece.
But for us, I want to know what's going on and what do we want to do about it?
What does it mean in this room?
What does it mean? Like I've had clients that I've understood what it was. And so we'll do I call it unofficial homework. Hey, I think I know what it is. Can you, between now and next session, can you do some exploration on these 3 or 4 topics and let's engage the conversation more? So I invite them into it from the therapeutic standpoint, right? But a lot of it when I do that is more about helping them have a foundation for, oh, this is what it is. Oh, okay, that makes sense. And then what do they want to do about it? Because my contention is, one of many, is I want to help, but I want to help you with it. How do you understand? How does it make sense to you, not me?
Right.
Because if it makes sense to you and you take ownership, my job, we've accomplished the goal. So that's how I look at diagnosis. I get it. It isn't the first thing I think about. My first thought is the person sitting in the room. Let's talk about maybe you both use the word suffering. You're struggling, the suffrage. Let's talk about that.
Yeah, I think it's a deep point.
Yeah.
Yeah.
How do you see the diagnosis?
I see it similarly. I want to play devil's advocate, though.
Do it. Do it.
Well, I'll just say to start.
Can we vote him off the island? No.
That'll happen. I can see by the look in your all's eyes. You've thought about it many times.
Absolutely essential to the island.
So, one, I think it can often be overemphasized, and I think people assume the diagnoses a lot of times are more, I don't know, grounded in something that they're not. A lot of these, it's just like
it's a legitimizing thing.
It's checklists of symptoms. I'm not saying they're not real in some sense or not meaningful at all, but they take it in the same way, like as if they're being diagnosed with high blood pressure. So it's pretty subjective, and they change over time. And
yeah, we got
they might
5
fit
editions
criteria
of the DSM now
at different points, and a lot of it, I think, is your point of the medicalizing it for insurance purposes. They want to see a medical disorder, but to play devil's advocate to it with it. I think there's times when clearing up a diagnosis is actually really important.
Oh yeah.
Where, like, for something like a bipolar, maybe someone's coming in depressed and they get diagnosed with a major depressive disorder, rather than eventually, which is not uncommon, seeing it as like especially if it's a bipolar 1, because the treatment can differ.
Very different.
So those are the times I think it's important, because, like, I'm not a psychiatrist or anything, but if you're prescribing certain medications for depression to someone who's bipolar, it can send them into a manic episode.
Yes, it can.
So things like that, where it's like it makes a difference. So I think it is important on some level, but I think it's overemphasized.
I think that's the thing that we started this out with about how does therapy work, this, that, and the third. Everything we're highlighting, it takes time, right? What we do as a profession, it takes time to hone these skills. You can be, I think we're born with a sense of engagement and connection with people, but schooling provides some, research provides some, but the ability to sit in a room, you got to hone that, right? And that doesn't happen overnight. And it's, we have clinicians that we work with. We've got a huge team here. Some have been around a long time. Some are relatively new. The newer ones, a lot of conversations we have is, it's not about being right. It's a lot of it is what do you see? What do you sense? What questions are you asking? Some of it's for you, but some of it's for your client. And so I say all that to say it takes time to really develop the art that it takes to do what we do. Because at some point we'll talk about AI and can it replace us? But right now, I don't think so. I think there's some. It's coming. It's here. I'm not gonna say it's coming. It's here.
Oh yeah.
But it's here with information, not how to connect with people. And that thing, I think that's what we're seeing in society right now is people struggle with just connecting. But we'll hold that for another podcast topic.
The will AI replace us thing?
Yeah, we can. Yeah,
Yeah.
I'll give you my 2 cents on it.
Yeah, I got some bills to pay.
I'll give you my 2 cents.
Not to sabotage this.
I love our fascination with things like AI and this other source of connection. Because I think that's ultimately at the heart of it. I think that's what people are striving for with developing AI. Like, we want more and more for it to engage with us. We put the different things in our homes that we can talk to and ask them to call certain people or make the lights come on and all that good stuff. Once upon a time, it was the clapper, and now the clapper talks to us. Yeah.
Clapper for the lights?
Yeah.
That was the first interactive
was too many.
things.
That was too many. That would have been on and off.
Yeah, you just said 3.
Clap
2.
on.
Clap.
Oh, yeah.
You did 3.
But ultimately, it was an interactive thing. It was a desired interaction between you and the space. I think that might have said something about how lonely we might have been and how lonely we might still be. But we want to make the space interactive with us. We want to make the computer interactive with us. We want to have that engagement. We're trying to replicate relationship with these non-humans, non-animal things. That is something that will develop. I think it's getting there. I think it's gotten better. But if you notice, at the same time of them developing the AI, whomever is behind it, they're also trying to develop the shell. Because we don't just want it to be able to talk back to us like a computer. We also want it to look like us a little bit, and we want it to engage with us and have facial expressions. We're attempting to create more of us that don't have some of us in it.
You went deep on that one. Yes, you did.
I'm just saying. Like, I love where it's going, but like, you got to look at where's it going. Like, what are we doing this for?
A lot of it is too much too soon. I think there's value in it. I don't know that we understand the gravity of it, because it actually exploded very much in the last several years, exponentially, and I think all professions are going to be affected by it.
Yeah.
Ours is one. I just, are we ready for it? I think the human, what is it? The opposite of addiction isn't recovery, it's connection. And what we're talking about is the connection or the lack thereof for our people. But you were going to say something.
No, I think you just spoke to it.
Okay.
Yeah. And yeah, I think it matters the fact that in this context, like a therapy type of thing within AI, that knowing on some level that the AI doesn't suffer would make it very hard to connect with it. I think that's to me that's the piece. Now, with that being said, it's just starting. We don't know what this is going to look like in 15 years. Of
course not.
It'll replace it. Who are we kidding? Yeah,
Well, hey, there's a great.
I'll be living.
But I'll retire by then.
Yeah, I'll be living in Craig's basement.
There's a
Walking up
great.
in my underwear, eating his cereal.
There's a great show on Netflix. I think it's like Love, Death, and Robots. And they've got an episode called Zima Blues, my absolute favorite episode. These are pretty short episodes, maybe 15, 20 minutes long. And it tackles the future. It tackles the fact that AI gets to a point where the question becomes, is it a human that has become a robot or a robot that has become a human? And it's beautifully done. Anybody who's got 10, 20 minutes, go check it out. Zima Blue, best episode of it. And it hits at that idea that we're trying to connect, and at the same time, we're trying to remove certain elements because maybe we don't want to have so much emotional affect to deal with. So that's why we're going in the heady direction. Maybe we don't want the other to have suffered. Maybe we want in some ways to leave that to be ourselves and eventually abandon it, let it go. Maybe that's where we're shooting for. Maybe.
Yeah.
What you got there, Matt?
You want to take a quick little sidestep here?
Sidestep.
Let's do it. Got the I don't know what y'all want to call this. Question from the people. Man on the street question. It really meant for just random questions people would want to ask a therapist.
Okay.
Y'all want to take a look?
Let's take a look.
Let's go.
All right.
As someone who hasn't been to therapy, how much are you listening to the patient versus actually providing specific advice? And what are y'all writing on that pad?
So what am I writing on a pad? I'm actually doodling. Like, when is this over?
List.
Is he done?
Yeah.
No. But in all
Apples, toothpaste. The hell's this
Christmas
guy talking about
gifts.
again?
yeah.
Yeah, it's probably
That's it.
something with your mother, something with your mother. Yeah.
No, in all seriousness, I'm listening. What I'm writing down are highlights, things to hold on to for me, things that you've said that are significant that I might come back to later or might not be relevant. Yes, I'm listening. Yes, we're giving advice, but it's more of not do this or do that, but more of a question. The question you'll hear us say all the time is help me understand. Hey, you made this statement. Can you make the connections here for me? I want to understand that from your vantage point. So that's how I do it. That's my question and answer. But on the pad, I'm just taking down highlights and points.
The only time I write is during evaluations. It's the only time I write.
You don't
Unless
write
I'm-
anything during session?
Unless I'm writing out how can I put it? If I do like a diagram
Okay.
to help a person kind of to illustrate an idea or illustrate the flow of something. Other than that, I don't do any writing during sessions. But when I'm writing during evaluations, you can definitely see when people's eyes light up and they realize they might have said something.
Yeah.
So what that does for me when I see those eyes light up is I see that as what we talked about before. You know something. You know, you just heard what you said. Now can you actually hear yourself for real? Because you've been walking around with this thought in your head all this time. You knew it's been there, but you finally said it out loud and somebody took note. And now you see it's important.
Here's a trick too, and I'm cutting you off.
Go for it.
When you say it important, I don't write it down right then and there. I learn to wait. I need you to finish your thought. You may have said it 5 minutes ago. I'm writing it down now.
Yes.
Because I don't want you to know what you said is important for me to know. Oh, I never write it right away when I do take notes. It's always I delay holding on to it. Go ahead. What do you do?
With the advice thing, I think to Charles' point, if we're just sitting there giving advice, if it's not in collaboration or coming from the person in some way, it's less likely to lead to change. But I've also, even recently, there's with some clients where they're really asking for some kind of advice. And earlier in my career, it was this thing well, I'm not supposed to be giving really direct advice, do this or do this. So I'd always kind of sidestep around it and what you do. And I've been realizing more if people are really just asking, really want advice, for me to be no, this thing, sometimes I will just give advice and try this, and then feeling what they think about it, and then here, run these as experiments, and then come back and let's see what happens. So it's something where they're learning something from it, but
I take two approaches when it comes to the listening advice kind of thing. So I'm always listening. And I'm listening to hear what's important to you. Because something might stand out to me and might really make sense to me. But if that is something that you're overlooking right now, me trying to offer that back to you as this important thing, it may just get lost.
Right.
Yeah.
So I'm listening for the things that are important to you. And I'm listening for what you might feel like you need approval for. So maybe you got the good idea and you talked about it, thought about it, worked it through, but you're just waiting on somebody to give you the okay, the green light to go and do it. And I'm not actually going to give you that green light. I'm going to help you see that you're looking for the green light and that nobody's more qualified to give you that green light than yourself.
So to wrap up, the insightful thought. We've talked today about does therapy work, the modalities, diagnoses. So Matt, what's your insightful thought for our clients, for our folks watching the podcast?
I think the insights are important, but I think they're mainly important in terms of how they can frame and inform how someone's going about having new experiences. But with the social anxiety example I was going to use, so I might talk to people where it's like, and about this kind of exposure-ish type of thing of kind of approaching the thing that's one's afraid of. Where it's like, well, I've done all of these, I've gone out to all of these different social things and it's terrible. And I did this last week. You might be going out into that environment, but are you truly exposing yourself to something that can challenge the status quo? In the sense of if I'm going out to a new, this person's going out to a social thing, but they're putting on a facade or they're checking their phone all the time.
You haven't gotten into this yet.
As what they call safety behaviors.
Yeah.
But then it's like, I don't self-disclose anything in these situations. Well, then I've never really exposed myself and my brain and my nervous system to the thing that's actually, it's all protecting myself.
Right.
And the protection becomes the prison. And I think in therapy, finding ways to be able to have the insight and then facilitate having the new experiences that will change the identity. I think that's really at the heart of where change comes from.
So change, I believe in change. I believe that change is something that we can all accomplish. I think that we need to have a reference point for where we want to go, and we do best with figuring out where we are when we can stop for a moment and look around and see how is it that I'm interacting with the world around me? What are my relationships like? And I think without that first part, it's really difficult for change to occur. If I don't have a good reference point for where I am, then what am I changing from? And if I don't have that second piece of where I want the change process to go, where am I going? And with therapy as a vehicle to get from point A to point B, it's so essential that our clients have given themselves a chance to imagine themselves differently. Whether they use a CBT approach to think about it differently or they use an EFT approach to feel about it differently, there's got to be at some level, whether it's coming from a place of suffering or a desire to strive to be their absolute best, there's got to be this belief that this isn't the only option. If this isn't the only option, then the options are boundless. But if this is the only option and all I can do is cope, all I can do is stay in this space and be who I've been because I've always been this way. This is how I was raised. This is how my family is. And all the other identities that we kind of bind ourselves to. If that's it, then therapy won't be as effective. It may be able to assist a person in getting day to day, through the days and all that good stuff. But when change really happens, when something actually shifts, it typically starts with the belief that it can. So that's how I think change occurs.
Oh, y'all giving a whole bunch of stuff. So how does change really happen? I think it's radical shifts in experiences, having the desire and the hope to do so. I think it's, somebody once said, the change in a therapeutic environment is having two brains, the therapist's brain and the client's brains. And those brains are figuring out the conversation that's happening. And so I think change it's not about what modality I use. Well, that's important. your devil's advocate, we were all in line. It wasn't that bad. But I think it's it's sitting in a room with somebody who wants to overcome some distress and us helping facilitate that process, however we go about it, in a non-judgmental way that is safe.
Yeah.
That's it.
There we go.